is to improve child mortality, to try to ensure that what is the figure, 67%? Two-thirds. And I think that now, since 1990, 12 million children died under the age of 5. I think the last figure we had was something like 7 million. And Millennium Development Goal number 5 is to reduce maternal mortality by 75%. And I think that in 1990 there were 500,000 women who died in childbirth, and now the figure is something like 300,000. So, Prime Minister, improvement, and you say you are an optimist, but the fact of the matter is the United Nations itself says that these two goals are not going to be met by 2015. How can you call that progress?
It's progress because we're at least approaching them. But let me start by saying that I've not always been optimist. Actually, I've been, usually I was a pessimist. In the way that and I remember very well when I traveled back home from New York, back in 2000, when we just signed the Millennium Development Declaration. And I was sitting in the plane, and I thought that this was just a new or another UN declaration, just with many words and very little action. But actually what has happened in the world since 2000 has proven that I was wrong, because there has been a lot of progress. For instance, development goal number 1, to halve the number of people living in absolute poverty. We have already reached that. We are ahead of schedule. And also when it comes to child mortality and maternal health, we are not where we should be, but we have reduced child and maternal death with about 40%, from around 12 million children a year to around 7 million children per year. And that's 5 million saved lives every year. And that's progress, and that's very good, and especially if you also take into account that at the same time the number of children born each year has increased, the progress is even more impressive. So the history of the Millennium Development Goals is a history that it matters, it's possible to move forward, and it's possible to make the world a better place.
Do you think we can now move forward? I don't know if you saw the report yesterday, which was co-authored by the ODI, that's the British Overseas Development Institute, which said that the impact of the global financial crisis has had a detrimental, deleterious effect on women in particular and girls worldwide. They're being pulled out of schools, their nutrition is being compromised because people can't afford to feed their families, and it's the female child and adult women who are bearing the brunt. So are you worried, Prime Minister, that the progress you have just talked about is going to be eroded?
I believe that the progress will continue, but I am very concerned about that the speed, the strength in the progress may be reduced, and that's partly because of the financial crisis. Because we have seen for the first time for many, many years that official development aid has been reduced, and the main reason is the debt crisis, the deficits in many developed countries. But at the same time, we see some countries with huge debts, with deficits, and they have been able to increase their official development aid. And UK is an example. They have given priority to development aid and being able to increase it, even if they have big problems with their deficits.
Okay, but as a powerful advocate of people giving aid, and of course we all know that when it comes to the proportion of, thank you, Prime Minister, of GNI. In fact, I should say, yeah, I couldn't open it. I have thank you, it is, and I've got that access. I've completed mine. I don't have your Viking strength, you see, but also I was using the Prime Minister as a human walking stick when we came along here because it was very icy. So thank you.
You can continue to do so.
Yeah, thank you. It's very versatile. The Prime Minister, as a country, and you've been applauded in Norway for giving 1% of your gross national income to overseas aid. But the fact of the matter is, it's relatively easier, let's face it, I have to be frank with you, for Norway, a country with only 5 million people, a great deal of oil wealth, to do that. Are you going around talking to your fellow political leaders saying you must continue this commitment to development aid in order that we don't compromise the achievement of the MDGs?
Yes, I'm doing so because, you know, a percentage aim is a percentage. So yes, Norway switched. So 1% is much more in Norway than in 4 countries. So I mean, the idea that we have an aim of reaching 1%, which we have already reached in Norway, is an aim of official development assistance, which take into account that different countries have different income levels. So yes, we have reached 1%. And I always like when people thank me for that, but it's not me. It's the taxpayers of Norway who have voted for a parliament, who have a majority in favor of a big development aid from Norway. So they just have to continue to vote in that way.
Do I detect that? I know you have an election in September, Prime Minister. Feel free. Bill Gates. Do you, just on this question of the world making progress on realising the MDG goals, in particular 4 and 5, we've been talking about, and also number 6, which you're very interested in, on HIV, AIDS and tuberculosis, do you detect that in the light of the global financial crisis, when you move around these international circles, that perhaps you're getting a bit worried that progress may be compromised because people frankly don't have the money one way or another?
Well, we have a lot of things working in our favor. You know, it's exciting to look at why was 2000 to 2015, why did we reduce childhood death faster than any time in history? We'll be close to a 50% reduction by the time you get to 2015, and that's never happened before. And the reasons that led to that progress, those will continue to work in our favor. That is, we have all the global actors aligned, including the developing countries themselves. In a previous session, Dr. Pate from Nigeria talked about Nigeria's own goal to save 1 million lives and how they're building up their healthcare system. And so the global actors are working in partnership with the countries, and the countries are very committed. They're seeing what can be done. There are examples of success on every continent that are driving this forward. We also have the benefit of science. You know, we have new vaccines that have been rolled out. Historically, rich kids get the vaccines even though they need them the least, and it takes over 30 years before they get to the kids who need them the most. During this period, commitments that were made through a vaccine fundraising called Gavi made sure that the vaccines got out very quickly to those poor children. And so rates of diarrheal disease, pneumonia disease, have gone down very, very rapidly. Now, science is going to give us new vaccines. We don't have a malaria vaccine yet, but donors are putting money into that. We don't have an HIV vaccine yet. And so in this next 15 years, we'll have science on our side. As you say, there are clouds on the horizon. I'd say the biggest is that whenever you have a financial crisis, there's a temptation to turn inward and just look at local needs, unless you've heard about the mind-blowing effect, the impact of this generosity. Getting that story out is it's a very important job. We can always do it better. The tools of the internet should allow us to do that. So I'd say you take all the factors into consideration. I'd say the next 15 years we will do even better, but we're going to have to tell our story more eloquently than ever before.
I don't know, you sound pretty eloquent to me, Mr. Gates, but you mentioned Gavi. For those of you who don't know what that is, of course, it's the Global Alliance for Vaccines and Immunizations, and the Gates Foundation provided the seed money for its set up in 1999 when you very generously gave $750 million. Mr. Gates, you also said that in the next 15 years, because we are after all talking about saving lives in the 21st century, which is the theme of this conversation, you say it's very important to engage national actors, and you are doing that. Because a lot of people say that is the elephant in the room, and they say that if you really want to deliver better health outcomes for people all over the world, in particular those who still form a disproportionate number of the world's most lacking in proper health, i.e. in sub-Saharan Africa, where no country is going to meet the Millennium Development Goals 4 and 5. That's apparently sub-Saharan African countries, the two MDGs, no country is going to achieve both. think that's right.
But
okay.
yeah, the maternal is set very, very high.
Yes, it is set high, but there is progress, I grant you that, but apparently no country is going to achieve both of those. But isn't the elephant in the room that you've got to engage national governments? The initiative has to reside with them, and the question is this: do you believe now that there is that kind of local, national ownership when it comes to major health programs?
Well, absolutely, and I think we can give lots of examples of that. We need to keep in mind that Asia is a big part of the challenge as well. Over 40% of the unvaccinated children in the world are in India. And my wife right now is up in Uttar Pradesh in the north of India, talking with the people there about their commitment to improve those vaccination rates. And so, yes, it's the governments doing like Ethiopia or Nigeria or India's doing, and making this a priority in terms of not just their budget, but also the kind of people they pull together, and stating very ambitious goals. And you want, in a democracy, a competition where each party is trying to say they'll do the best job on improving people's health.
But I should just remind you, you say that they are signing up to the goals, but if you look at the evidence, in particular of African countries, I won't dispute my figure here, but I think that the African Union says that back in 2001, when the African countries, is that for me, thank you, when the African countries signed up to the Abuja Declaration, to the Abuja Declaration in 2001, when African countries pledged to spend 15% of their budget on health. Only 6 countries, according to the AU, have now met that still it falls far short of that. And there are other startling figures when it comes to health provision. If you look at the Central African Republic, one of the countries in the world which has the worst maternal mortality rate and child mortality rates, Médecins Sans Frontières spends more on health than the entire national budget does. And so my question is, when you talk about this commitment from national governments, do you really sense that there is a change in the zeitgeist amongst those countries that historically have not spent enough on health? And I'd like you to address that too, Mr. Stoltenberg.
Well, let's take the countries in sub-Saharan Africa with the greatest population. Nigeria has a huge commitment, a lot of work to be done, but it's great to see the energy being put into it. Ethiopia is the next largest, huge commitment, rolled out a primary health care system, making a big difference. The third largest is the Democratic Republic of Congo, and there you'd say no. There's not enough infrastructure, taxation, strength of the government, and they're very dependent on outside expertise. But overwhelmingly, Africa is far more engaged in these issues today than ever before. They do need to increase the domestic budgets. They've gone up, but not nearly as much.
And do you tell them that? Do you say, look, Gates Foundation can't do it all, guys and ladies, but you've got to also cough up. I mean, a lot of these countries are commodity rich now. Nigeria gets, what, $40 billion a year from its oil wealth? There's no reason why it still has 2/3 of its population living on $1.25 a day.
No, that's right. That's another source of additional resources. And I think India's been a real exemplar in this. Their health budget has gone up a great deal. Now, a lot of what they need from people like Norway or a foundation is the expertise we bring in. Measurement tools, really highlight how are they spending their money in the best way. Africa's a little behind that as a whole. You'd say it's maybe 10 or 15 years behind where India is, but it is following a track of putting more resources in. You'll always have a few places like Central African Republic or Somalia where you just don't have any of the basics, and the outside actors have to prop things up on a humanitarian basis until you can get more of a government in place.
But you do see a shift that the main ownership of major healthcare is moving towards the national governments, the local ownership. You feel that is the case, and that's going to continue to be the case in the 21st century.
That's right. In many African countries, if you go back 10 years, you were mostly funding around the government. And there are still a few places where that's really the only way things get executed, Somalia being an extreme case. Now the funding is through the government, working with the government, and they have a commitment to bring in their part of the financing. For example, in the vaccine case, Global Alliance for Vaccines, there's always some co-financing, even if it starts out fairly small, that's coming from the national government. And they're making a commitment that as time goes on, that they will eventually graduate, and that will come from local financing.
Prime Minister, on this issue.
But I think the discussion now just illustrates that there are important differences between different countries. And when Bill and I say that we are making progress, we're not saying that everything is fine and that we have reached the goals. For instance, as you mentioned, the child mortality rates have been reduced by around more than 40%, but the goal is 2/3, and we're not there, and we will most probably not reach 2/3 by 2015. But still, to reduce child mortality by 5 million children every year is progress, and we shall get some kind of inspiration from that and learn from those countries who are able to make progress, and then try to implement that in those countries who are not making progress. And of course, there are big differences, and one of the things I really liked with Gavi from the beginning on was the idea to have this result-based financing. We paid for each child immunized, and we paid some money when we made the agreement with the country, and then we measured progress, and if they showed progress, they got more money, and then they get the rest when they have immunized all the children we agreed on. So that's the way to, in a way, mobilize also national obligations, national efforts to have this pay per child immunized, and I think that's part of the success of Gavi.
Okay. We've had some questions from Twitter on this global health event, and just a couple of questions around what we've been talking about. What is the single greatest threat against children's health, and the most effective measure to deal with it is one question. Which would you don't like to answer that? What is it in your view? Okay.
Well, the respiratory disease, pneumonia, still kills most kids. That, diarrhea, and malaria are the 3 biggest killers. And there, we have tools that we just need to get rolled out. In fact, for diarrhea and pneumonia, we have new vaccines that are in the process through Gavi of getting out to all of these countries. And so, breaking it down disease by disease, we see where we need new tools to be invented, and then as they are created, how do you actually get those rolled out?
And Prime Minister, another question. How can you have adequate maternal and child health in the absence of women's rights? And that's a much harder objective to achieve, isn't it? Trying to re-educate people in terms of, because so much of women's rights revolves around sexual and health reproductive rights, and sometimes you run across cultural barriers. The awful practice of FGM, which still it persists widely in so many countries in Africa and parts of the Middle East. These are the kind of things which are not so easy to just sort of change overnight. So how would you answer that question on Twitter?
Every second minute, a woman dies in connection with childbirth or pregnancy, and of course that's one of the most provocative examples of discrimination of women, because most of those women could have been saved easily, and that is the way the really big disaster that it's quite easy to do something with, and it has something to do with prejudice, it has something to do with discrimination of women. And therefore, it's very interesting the work we are doing to reduce maternal deaths with strengthening or empowering women. And one way of doing it is just an education for women, increasing the age when they get pregnant. More contraceptives are very effective measures to both give women more control of their own lives, and also, of course, to reduce both child and maternal deaths.
And how do you do that? Because there are a lot of advocates. Obviously, I work in the media, and so I would say this, but it's absolutely true, that if you have public health campaigns through local radio stations, or for those people who are literate, through local newspapers, through community organisations and so on, you run some kind of a public campaign, just as in the UK we had, wear your seatbelt because it's going to keep you safer in the car. And the role of the media is very important in that.
There are many things to do. Partly it's a question of providing the services, the midwives, the clinics, but partly also to change attitudes. And then I think just to speak about it. Sometimes it helps just to speak. So when you arrive in the capital, you ask the president, I ask them, what do you do when it comes to, for instance, contraceptives or providing help to women who are going to deliver and so on. So just to have more public focus is in itself making progress, is in itself helping different countries to move forward when it comes to maternal health. And in